Good morning, I believe, everyone. My name is Jakko Brouwers. Manchester, not the shop, but the town in England. And this beautiful background behind me is the children's reading area in the theatre, where I've just presented at another conference. And what better place to find than a reading room with all the fairy tales and the books behind us. But the case study that I'm going to present to you is not a fairy tale. It's not a made-up story. It's a real story. It's a story about Rhys, a gentleman who is with you, and is a gentleman who we've got to know really well. I believe you can see the slides on the screen, and if I can ask someone to pop up to the second slide. So Rhys came to us at first in 2020, I believe, towards the end of the year. We all know what a difficult year that has been for people, and he felt that he had significant stiffness in both of his legs. The stiffness, particularly in his hips, and he also experienced shaking in his legs from time to time. He was able to walk independently, but he preferred to use a wheelchair, especially if he was going any distance outside, because he didn't feel confident enough. At times, Rhys also experienced dizziness, but the dizziness was always short-lasting, or predominantly short-lasting, and he had double vision when looking. If we can have the next slide, please. Yeah, Rhys expressed that he would like to have some help from us to help improve his walking and balance in particular. Rhys also explained that he hadn't had any physiotherapy in the past for his condition. We can have the next slide, please. We continued to do an assessment on Rhys, and the assessment is here summarized in what we call an observational gait analysis. Rhys was able to walk independently, but with a wide base. His gait was quite stiff-legged, so his legs were more robot-like than naturally flowing. He had occasional unsteadiness, particularly when he was changing direction or when he was turning, and he kept his head quite fixed while he was walking. Was mainly used for getting momentum for his steps. Then the other thing was that Rhys was seen to use his toe extensors, and he had reduced ankle and foot movement throughout his gait. And he appeared to have his weight further back onto his heels rather than leaning forwards onto his toes. Next slide, please. We then had a look at his spasticity and his muscle tone, and he showed to have spasticity and also clonus, which is a shaking of the leg after a stretch on both calf muscles on both sides. He also had some mild spasticity in his quads, in his thigh muscles, the front of the thigh, which was related to the stiffness during his walking, stiffness of his knees. He showed to have normal muscle power, which is always a good thing. But his calf muscles, probably because of the spasticity, the clonus, and his gait, that well. His trunk was stiff in all directions, so he had limited mobility in all directions when he was sitting. He was kind of moving as a block rather than to have segments of his trunk moving independently, and there was reduced coordination of his lower limbs. We didn't test him for sensory impairment, but we didn't assume that there was big problems with his sensory impairment. And he had reduced balance in general, and he can be easily displaced with a small perturbation. So if he had a small nudge, he would lose his balance quite quickly. Can I have the next slide, please? Then summary of what we found. So Rhys had a difficulty balancing whilst he was standing, and when he was all of this together was leading to a reduced balance and gait. So his gait was abnormal due to these impairments. We felt that the rehabilitation should be focused on. Can I have the next slide, please? The rehabilitation should be focused on getting good mobility of his feet. So his feet were quite stiff. So if we would make those his feet a bit more mobile, he could bring his weight forwards again, and to reduce the stiffness in his trunk, so he could start to access his pelvis loosely, moving away from his upper body, from his trunk. We also felt that we needed to work on his balance. So we set out to do therefore on unstable surfaces, and they would involve him to shape his body in accordance to those changed surfaces. So if the surface tilts, then you start leaning to the other side. So we really wanted to get his body shape to change and get rid of some of that stiffness and make it more dynamic. We also wanted to introduce some head and eye movements, because his balance was particularly bad when he closed his eyes and when he was standing on a soft surface. So we felt that all of that should be practiced, and we created what is called the hologram for him. As well as his eyes open. And we also set him up on a treadmill to do some treadmill training. The treadmill that we've used for this, can I have the next slide, please? The treadmill that we use for this is called a C-mill. C-mill allows you to create augmented feedback. So that means that we project with a projector images and feedback on a belt. And then you need to either hit those targets or avoid those targets with your feet. So we can look at accuracy of placing your feet, but we can also set them out to be a little bit harder to achieve and thereby pushing someone. We can also do balance activities on it, so it's not necessarily just about walking. However, Rhys, as said, came to us in 2020, first off. His gait speed was very, very slow. A normal gait speed is around 5 kilometers an hour, and he was 0.7 of that. So he was very, very slow. His step length on the left was more reduced than on the right. And a normal step length is normally around 45 to 50 centimeters. So it was significantly reduced. His step width was 23 centimeters on average. It's normal to have a step width of about 12 centimeters. So again, he was for 30 minutes before he ended out. And complete 2,000 of steps. So can I go back to the previous slide, please? So then currently he is able to walk at 5.6 kilometers an hour and sustain that speed for almost 10 minutes during treatment sessions. So that's an enormous improvement. That is beyond normal walking. He's a very confident walker. His step length is normalized. His step width is normalized. And within that 10-minute time, he's able to walk almost 900 meters. So again, that is a really good improvement compared to where he was a couple of years ago when he came to us first. Can I have next slide, please? During walking is that we can see where his force that he was putting through the treadmill, which we can measure and display in these images. So we've measured every single footstep on that first assessment, and then we've measured him again in May of this year. So you can see in 2020, he's taken an awful lot of steps. There's a really wide variety of blue lines and red lines, and then the computer has done a fat line over the top of them where the average is. But the main thing to take away is that there's an enormous amount of variation between 2020 compared to 2025. So there is a lot less variation in this movement pattern. The dip that you see in 2025 in the middle of that graph is normal, and it is more to do with speed he's walking at. So when you start running, that middle dip disappears altogether, so that there is then no pressure. A bit of time. So the force projected to the belt creates that dip when people are walking faster. However, he does have a little bit of a lump on the first part of the 2025 graph, and that seems to indicate that he does still have some instability in his hips that we would need to work on. Can I have the next slide, please? Then the other part of Rhys that is dramatically improved is that when he is walking, you can see here the center of pressure over the belt, and I've tried to get two images of what we've recorded on your center of pressure of being where your weight is underneath your body over the floor. That's the center of pressure. If you're standing on one foot, then of course your center of pressure is on one foot. But if you stand on both of your feet, the center of pressure is somewhere between your 2 feet. Now, when you're walking, that center of pressure moves like a snake over it. And when you're then walking on a treadmill, that S shape falls back onto itself and creates what we call a butterfly shape. And you can see that butterfly beautifully in 2025. And again, in 2020, you see there is an enormous amount of variation for almost spent on going sideways with that center of pressure and not going forwards with that center of pressure. So again, an almost normal 2025 picture with regarding to his gait. So then my final slide, if I may. I think the main thing that we pride ourselves on with Rhys is that we've not just helped him regain walking or regain balance and to improve his physical function. We've also been able to witness how he's been able to improve his quality of life. And after all, that is really why we do these things and what's important to us. Because Rhys has been introduced 2 years ago to cycling. We didn't think he would ever be able to cycle. We were holding a fundraiser at Morrello, and Rhys joined for the fundraiser. And with a little bit of twisting of his arm, he agreed to get onto one of the trikes, the cycles, and we images of a ride that Rhys organized around Christmas, which we call the Santa ride, where together with patients and relatives and friends of Morrello, we all cycled into the city center, went for some coffee and cake, and then cycled back. And Rhys has been a driving force for us to organize these rides. So I've been trying to claw a few minutes back, so I'm gonna leave it at that. I'm gonna pass over to Tom Hughes, if that's okay with you.
All right, Rhys, come on up. We're gonna go right to you. You're live and in person. Thank you.
Oh, hey everyone. Just let me know if I'm talking okay, because it's difficult with the cochlear implant, but if everyone can hear me, that's absolutely fine. So you might know me. I was diagnosed with superficial siderosis in 2016. It was a long journey getting there, so I'll talk to you about a bit of my background and how I came to the diagnosis, and then I'll talk about some of the ways that I managed the condition. So when I was growing up, football was everything when I was in primary school or elementary school, as you guys say. It was all I did. My mum used to take me back and forth to soccer all the time. And it was school, soccer, school a few times a week. I played for my local team. I played for the Newport, which was the town at the time. It's now a city. I played for them as well, which I was scouted from school. And then I also got scouted to Cardiff City as well, which is the capital of Wales, where I live. But then when I was 8 years old, I had the sudden onset of symptoms: blurred vision, fatigue, vomiting, dizziness, double vision, chronic headaches. And I've been to the GP so many times. My mum was frantic because I was really ill. I couldn't get out of bed because of the fatigue. It was that bad. And the GP kept saying it was a virus. So I had the eyesight issues. So my mum took me to the opticians. And that's when he could see the discs at the back of my eyes were swollen. And he made an urgent referral for me to have a CT scan at the eye hospital. And then I was diagnosed with a brain tumor. So then what happened straight away then, my dad, I can remember rushing me to the hospital in Cardiff where they do the neurosurgery, and the neurologist, a specialty there. And I had a scan and they diagnosed me with a pilocytic astrocytoma, which is a childhood type of brain tumor. It's benign, it's not cancerous. And they performed the craniectomy surgery, which is where they remove the bone at the back of the head and they don't replace the bone to relieve pressure on the brain. I went home for a day, and then I ended up back in hospital again with similar symptoms to the tumor, which was vomiting mainly, a temperature and pyrexia and all that. And I spent 7 weeks in hospital, so I missed a good chunk of school as a kid when I was 8, 9 years old. And after that, it was back to school as normal. So then a few years later, I just started high school, which is age 11 in the UK. And I had, again, similar symptoms to the tumor, and a brain scan confirmed hydrocephalus, which is the fluid buildup on the brain. So I had this VP shunt fitted then, which is a device to drain the fluid from the brain into a cavity in the stomach area. And because of the fragility of my head then from the neurosurgery, they told me I had to stop playing football. And that VP shunt, it blocked a few times, and the raised pressure on the brain, it can be fatal if left untreated. So it was a case of urgently getting back to the hospital to have that unblocked. And they eventually put a front bit on the shunt, which a second valve. So I had like 2 valves. When the pressure gets too high, the valve releases and drains the fluid. They put the second valve at the front, which seemed to stop the problem with it blocking. So then what happened then was I caught up in school. My dad bought me a guitar because I was always used to, music was my life anyway as a kid growing up. I used to go to concerts with my dad, and he bought me a guitar to replace the football, soccer, which I couldn't play anymore. That's me. I studied in college, or sixth form, which is where you stay on a few years in school to do like advanced levels. And then I went to university to further my studies in music, because that was what I loved to do. I had a bout of meningitis and pneumonia then, so I didn't actually complete the course in full, and I was working part-time, and I continued to work then whilst playing in bands in my spare time, which was everything I did. I played in quite a lot of bands. It was good fun. So then it was 2011 that I first noticed the hearing loss whilst watching Lord of the Rings. I thought it was the telly at the time, but come back to that. And it was the same sort of minor hearing loss, both sides, and then a high-pitched ringing, which I used to get occasionally after going to concerts or playing music, but it would go straight away after that. I think it's normal, most people get that after loud noise, but this time it was just there constantly. And I was told when I had a hearing test that it was most likely from meningitis, which I had before. And I was prescribed hearing aids and able to carry on playing music and working as normal then. So I had this was one of the first symptoms that I thought something was really wrong. And I just started a new job. I left the job I was in and to go into working in car insurance. And we went like a team building afternoon out, and whilst we were out, went to archery, and my legs were violently shaking, almost like they are now, but so bad that I couldn't stand up. I was trying to pull the bow back, and as I was putting tension on the bow, drawing the bow back, my legs were like this, and they took the bow off me, and I thought, that's not normal. So they made me sit it out, because they don't want me shooting anyone with a bow and arrow. And then this was the nice part. They thought it was my blood sugar. So an old man gave me a big bar of chocolate. This then couldn't have been 1-2 weeks later on. So I was getting ready for work, and the job that I just referred to had started. And I woke up in the middle of the night. I had a screeching sound in my right ear. And this really intense headache on the same side as well. It was just maybe 1-2 o'clock in the morning, and I woke up, I had this dizziness as well, and it was like almost like a siren going off in my ear is probably the best way to describe it. And it felt like my ear was popped, like it was when I was coming here on the plane, actually, the same sort of sensation, but I couldn't get that feeling to go away, but only on the one side. And then it turned out that I also had really bad hearing loss, and I couldn't hear anything out of this ear. So this is where I really started to realize that something was going on. And I became more and more dizzy, had a persistent headache, mainly on this side, which started to sort of move across my whole head. And I noticed at the time I couldn't taste food properly or smell properly. And I went to the audiologist and had my hearing checked, and he noted a 20 decibel reduction on my right-hand side, which I thought it was only that side, because that side, I didn't have any sort of sensations that side, on my left side, sorry. And the fatigue started kicking in. And I was awaiting emergency referral to see the ear, nose and throat department to find out what was going on with my hearing. And then at the end of that year, in 2015, the shunt that I had to drain the fluid suddenly blocked again, which it hadn't done since the end of 2002. So that would have been, let me do my maths, 13 years later. And I had the shunt revised, which I thought was going to be the end of the problems, where they just unblocked it in both sites. So this is then where things started to move forward, and I was finding out what was going on. I had to surrender my driving license because I had neurosurgery and it wasn't safe to drive. And I'd noticed double vision whilst waiting for the bus because I couldn't drive anymore. And there was 2 buses coming. I thought I was in luck, but no, not at all. And I saw another neurologist who suggested having a lumbar puncture to see if it resolved the pressure in my head. So he wrote to my now current neurologist, Tom, who we're waiting on at the moment, chop. And he said, do a lumbar puncture to see if it'll help out and the symptoms that I had and resolve itself. But when they did that lumbar puncture, I had xanthochromia, which is all blood products in my spinal fluid. I can remember it all like yesterday. There was this junior doctor, his name was Will, and he held it up and he went, is your spinal fluid always this colour? I said, I don't know, can't remember. But it was a nice guy, and I thought that was the best lumbar puncture I've ever had. When I was a kid, I used to hate it. So I said to my neurologist, Tom, I'll make sure you get him to do it again. I had a series of lumbar punctures. He got Will to do it again, and it was the worst one I'd ever had. So this is where I sort of got to the diagnosis, because my spinal fluid was consistently yellow in colour, with raised protein and inflammation. It's a 2-week hospital admission. I made lots of friends at that time. There was quite a wild, one of the most exciting hospital stays I've probably ever had. I remember, forget that one. And it was such a long wait waiting for this scan to find out what was going on. My symptoms were worsening. I started to have a bit of hearing loss on the other side now, which I kind of expected was happening. I eventually had the brain MRI scan, and that's the exact scan there. And you can see the superficial siderosis, which is, I can remember Tom coming to my bedside and saying, with his finger in the ear as he does, "We think we know what's wrong. You've got iron on your brain." And he said he had to speak to his colleagues in London. And that's when I had a look online and found out about the drug deferriprone, which I then ended up starting in April 2017, and I was the first one diagnosed in Wales with this condition, so it hadn't used it for that before, so we had to go through all the channels to get it, but with Tom and my politician's help, it was quite relatively easy to do. And then because of this, I had CSF pressure complications, and the shunt kept blocking and blocking. I had multiple shunt blockages, as I said, and lots of surgery, so more blood was coming into my spinal fluid from all these surgeries, and I counted I had about 21 brain surgeries altogether, so it was quite a lot, a horrible time. Eventually, at the end of 2018, I had a CT cystonogram where they put the dye into your spinal fluid, and it picked up a leak which was at the back of my head, and that's when I think initially spoke to Dr. Levy, and he sent me a lovely email and suggested to look for that as well. My surgeon did. He was on holiday at the time, or vacation at the time, and he came back and they did this scan and found the leak at the back of my head. He came to my room and pointed, and then he said he come up with this idea where he would repair the pseudomeningeal seal, which is the collection of fluid that was left all the way from that tumour removal back in 1998. He said to me he was going to order this PEEK implant, which is a type of medical grade plastic. It's polyether ketone. And he sent my MRI scan dimensions off to a place in Germany, and they designed a custom implant to fit the cavity, to a T at the back of my head to close the pseudomeningeal seal and the defect. And that there is a scan I had after it, which is a indium 111 DTPA cystonogram. So the red you can see on the scan, the orange, sorry, is that's the dye. It's a radioactive dye, and it's like a cystonogram myelogram, but the difference is the radioactive dye is the tracer stays in your system longer, and they scan you over a number of days. So if there's any like slow leaks, it's more likely to pick it up. And there you can see the implant at the back of my head, which is there, and it completely stopped the CSF leak, as you can see on there. Was my other one. You could see it on the normal myelogram. So this is where I have more pressure problems than because I think I've been in such a low pressure state for so long from having a CSF leak, which most of the time is spent lying down and drinking lots of caffeine, which is supposed to regenerate CSF or make it produce quicker. They decided to remove the shunt, and I had an endoscopic third ventriculostomy, which is where they make a burr hole in the third ventricle so the CSF to drain, so it doesn't reduce the pressure. And following that, then the pressure stabilized, which was really nice because I didn't have popping in my ears at all then. And that was actually the last neurosurgery I had. And then I had a free run on deferriprone where there's no more blood infiltration into my spinal fluid. And that's me holding up a clear spinal fluid at the end of 2019 with my SSRA t-shirt on. And I've had multiple MRI scans, and I've been told that quite a few different radiologists have reviewed it, and they can see a reduction, and the ferritin levels in my CSF have come right down as well. Initially, remember back in 2017, they'd never done CSF ferritin measurements in Cardiff before, so they sent my scans to Queen Square. Natalia kindly sent me the results to that so I could compare it to the ones I got now, and it's quite a significant difference in the reduction of the ferritin levels. I'm happy to see that it's fallen consistently over the years, so it's sort of stabilized in between having the surgery to stop the blade leak and taking the deferriprone. And my symptoms have flatlined. I'm still dealing with the symptoms that I've got, but it's not got worse at all. It's a case of just maintaining everything now. And I learnt to walk again after being in a wheelchair through, I don't know if you could hear Jakko, the connection wasn't very good, but yeah, it's constant to keep that up. And I had a cochlear implant fitted then in 2023 after being deaf, completely deaf for 5 years. So I just want to talk now about the symptom management, which I always say is a full-time job because it's a lot of work just to maintain everything. You know, it's not just one thing. So much going on with this condition that it makes it very time-consuming and difficult. So the first thing I want to talk about is hearing loss. I think the longer I've had the hearing loss, the more I sort of learn ways to manage it. The first thing was the hearing aids, which I wore for many years before the symptoms really kicked in. And the other thing is sitting, facing the person, having light, because if you've got hearing loss, you subconsciously lip read as well, so it's always good to face someone directly if that's possible, and have the light, because if it's dark, it's impossible to lip read. Something also got used to doing was just going, yep, yeah, of course, yep, and you don't hear what anyone's saying, you just agree. So if you don't hear it, ask someone what they're saying just to make sure, because you never know what it could be. Me and my mum started learning sign language as well, which it's been great to learn something new as well. And we've done our level 2 British Sign Language. Looking to go more. I go to deaf clubs, a deaf club thing now, just to get involved with people who are using sign language to maintain it and learn more as well. This is a great tool I used whilst I was at the hospital. I had no hearing over the 5 years because I was having all those surgeries, and it was my surgeon's inspiration. I couldn't hear him the one day, so there's like a kid's toy etch-a-sketch thing, and he just got that and was using it to write on so I could work out what he was saying. And we actually called it the G board because his name is George, so it ended up as the George board, so it was a bit of a laugh between us as well. And whilst I was asleep as well, the nurses used to doodle on it, which I took photos on. See if they were the high dependency neurosurgery ward. And then something like this came out. Google Live Transcriber saw someone else using an app. Yeah, this thing has been fantastic. I still use it now at my appointments. It picks up the biggest of words as well. It's better on a one-to-one situation because they can pick up, someone across the room depending on their tone of voice, and they could be someone right next to you. The alarm clock as well. This thing is quite a violent shake, but you put the pad under your pillow and set it off because you can't hear at all. It can give you a big fright, but it does the trick. And same thing with a fire alarm or burglar alarm as well. So I've got these two things under the pillow that the burglar alarm is the worst because a bit of dust gets in it and it just sets it off and wake you up like 3 o'clock in the morning and you think there's a burglar, but it's not. Another self-explanatory is the subtitles, which are really helpful anyway. If you're using like social media as well, most videos have the captions because people watch them in the quiet. They don't want everyone hearing what they're watching. And closed captions on Microsoft Teams, Zoom, those sort of things. And I've speak to my doctors, tell them to email me over using the telephone. It's still trying to get everyone to do it, but it's a lot easier to communicate over email. I can use the telephone to an extent because I've got a telephone with captions on, but when you get the automated numbers, press 1 for this, that, the other, it becomes a bit difficult. And then I had the cochlear implant as well back in 2023 after not hearing anything. It's been revolutionary for me. It's been absolutely life-changing. So cheers, David. As Jakko was saying about the mobility management, I use a walking aid every now and then. It depends how my legs are. If it's cold, my legs are shaking. Like now, they're freezing. And I get dizziness as well, so the walking aid is really helpful. was in the wheelchair until I started going to Morrello as my neurosurgeon that told me to use a wheelchair. So I was walking, he wanted to show me that scan earlier, the one with the radioactive dye. And I walked from my bed to it, and I can remember trying to walk back, and I almost fell, and he grabbed me. I didn't realize it was behind me, so thankfully. And he said to use the wheelchair. And that's the treadmill I've used at the Morrello clinic, which is just a case of maintaining it and keeping, keep doing it to maintain what you've got and try and push that a bit further. And the key thing I say is people, it's a lot of work goes in. I do exercises at home as well, and it's just to keep going and going and going. And so I thought I'd do a bit of language as well here. So it's a bit like practice, practice, and more practice. Practice. Something else I've adjusted as well. This is mainly for my gut, but I wanted to introduce lots of antioxidants that could potentially help with superficial siderosis and reduce oxidative stress, but we just don't know. But I've made a significant change to my diet, particularly like in breakfast and things like that, and things that are easier to digest, because I struggle digesting thick foods like breads, but I do love pastries. Eating times as well. I try not to eat after 6 o'clock if I can, because again, it takes me longer to digest food and I'll wake up with a bad gut if that's the case. And I take lots of supplements and vitamins to try and introduce more antioxidant that I can, and just to try and maintain everything. It's very difficult to fit everything in, but it's doable. It takes a lot of planning as well to get used to the regime. The pain management. This is something I suffered with headaches, and I tried all different treatments, but this helped for me massively, which I suffered from these headaches, which they said were actually from pressure in my head, which was still slightly raised, but not really raised. And I'd had all the surgeries, so my nerves were damaged at the back of my head and still are. And that injection has been so helpful. So before that, I tried the medications, oral medications and nerve blocker injections. I'm glad I didn't put the one photo up there, because I had an injection in my eye for supraorbital nerve blockers. That was really painful and did nothing but make my eye bleed. But the Botox therapy has been incredible, because I was waking up with these headaches and I couldn't function until 1, 2 o'clock in the afternoon. But the Botox therapy has really dampened it. So the headaches were like from a scale of 1 to 10. I'd wake up, they were a good 9, and then they'd subside the more I was upright, to do with pressure again. But that has been, such a huge thing for me to give me some independence back, and so I don't have to spend most of the time trying to get rid of the headache in the morning. And again, unfortunately, it's not a one-size-fits-all thing. It's a case of having specifics of, the type of pain that you've got, and to see a medical professional that can help with that, whether it be headaches, nerve pain, or whatever type of pain it is. Fatigue is something really bad as well. I get very tired, and I just get waves of tiredness I can't control. So I could just be doing nothing, and I could just get this sudden onset of tiredness, and just need to know when to rest, and to know when you need to stop to recharge your batteries. And the routine helps as well. Just knowing, I didn't write that list, by the way. I wouldn't inspire someone that's not, it's just something I got online. And just do what you can and know what you can do, and just trying to fit things into the day so you get enough time in the day to do what you really need to do. And to try and get a good sleep pattern, which I find extremely difficult because of the tinnitus mainly. You take the cochlear implant off night, and that's all I can hear is ringing, and I can still hear it now. The more I talk, the louder it gets. So it's a bit difficult because I like talking. And the mood management, so counselling, I'd never considered this, but after everything I'd gone through and everything I'd lost, not being able to play music, going to concerts, socialising, it affects everything. This condition has just been really depressing, just knowing to try and move on, and that's something I try to encourage, is to forget about the past and focus on the present, to improve what you've got now. And it's one of the hardest things, I think, especially when you try to think how you were to how you are. But I've come to terms that I have to accept I've got this condition, and I find accepting it is the best way to move forward. And I found, again, through what Jakko showed with me dressed as Santa Claus, I don't do that every week. But yeah, the recumbent cycling has been such a good activity for me. At the charity in Cardiff, Pedal Power, which I found through Morrello Clinic. We go out, and it's a group of like-minded people. I'm the youngest one there, and I lead the group with my friend Malcolm. But everyone has got some sort of neurological condition, so we all understand the symptoms we get. And I found that bothering with people who get it is something that's really beneficial and nice to have, because you don't feel different. So I just go through the other things, is the bowel and bladder management. Every morning I wake up, I get a bowel movement, and then I get another one, and I get another one, and it defines my day really in the morning, and it's so difficult to manage. I don't usually talk about it because no one likes to talk about bowels, but that's a sort of day-defining condition for me. And the bladder, especially when it's cold. We could be out cycling. Again, that's why I like being around people that get it, because we all know we need to use the toilet and plan when to use them. The tinnitus, trying to sleep again, and when I'm talking, I try playing my guitar again, and it's difficult because the tinnitus gets so loud, the more noise there is, that I can't hear what I'm doing. So it's been a bit of a blow for me, but it's something I try to switch off on and forget to try and do something that I can do. This is the other one, the overactive sweating, hyperhidrosis. Yeah, it can be cold and I can sweat, it can be boiling, but I had a test in London where they covered me in this lovely orange powder, which turned into like a red mush after they put me into a sauna for an hour. How long can you last in the sauna? That was the question they were asking me. I did the full hour and it's covered in this horrible stuff, and it turned out my bottom half is not sweating, but my top half is overcompensating for that. The eyesight issues, I got the double vision, so I have to wear my prism glasses all the time for driving and for everything like that. And watching the telly is about knowing where to sit so you can see everything straight on. The temperature regulation, again, whether it's the sweating or the heat. I get pain as well from the cold sometimes, like my feet get so cold they hurt. But it's about finding ways to manage that. So my mum bought me some lovely heated slippers, which are great. You just put them in the microwave and when my feet just like, ah. And this is I wouldn't say it's a recent one, but something I've noticed more is that I struggle to swallow dry foods. So breads and things like that. It's about knowing to have a glass of water there to make sure you can swallow something properly, or those sort of things. So we're trying to manage everything and just juggling the symptoms, and that's what my life revolves around really, is juggling the superficial siderosis symptoms. Thank you. Am I right to take some questions?
We'll do it with the panel.
All right, yeah, okay.
All right.
Yeah.
Thank you.
Thank you very much.
Guess what? It's lunchtime. Let's